Hi everyone, welcome to my first video on this channel about the anatomy of the eye. Just to start off, I'm going to go ahead and draw a model here that we'll refer back to throughout the video. I'm just going to draw some eyelids here, draw the optic nerve, kind of talk about the eye from the anterior to the posterior. So I'm circling there, I'm circling the front of the eye, I'm circling the eyelids, I'm circling the optic nerve, just so everyone has their bearings. So the first thing that we're going to talk about are the eyelids and the structures over there. So like I said, just going to start anterior to posterior. And the first thing I'm going to talk about are the tarsal plates. So that's what I'm drawing here in pink, are the tarsal plates. They're kind of like a fibrous structure that line the inside of our eyelids. I'm going to label it here just for clarity. I'll try to do that throughout the video with all the structures. And on the tarsal plates are these things called meibomian glands. I'm drawing those here in teal, this turquoise color. Labeling that again. And the meibomian glands, what they do is they secrete oil into our tear film. Okay, so before moving on here, I just want to hit the pause button for a sec and rewind because I did a poor job of drawing the meibomian glands. They're not actually those little dot structures that I drew earlier. It's more like what I'm drawing right here. So you can see it's a little bit more glandular. This is kind of taking a cross section of one single meibomian gland here. I'm going to label it again just to make sure it's super clear. And these go from one side of the eyelid to the other, almost kind of like a horizontal line series. So I'm going to draw this other model on the left here to better demonstrate this. And again, meibomian glands in teal. So you can see they're kind of in a series horizontally going across the eyelid from one side to the other, top and bottom. Open at the lid margin. And then I'm going to draw these arrows to show this is the direction that they secrete oil into the tear film. Just to make sure that everyone understands what the concept of tear film is, just because it's not super clear. I'm going to draw one more model eye over here. I'm going to label the cornea. That's the front of the eye. And then just in front of that in the red, I'm drawing the tear film labeled as well. And when we take a cross section of that, you can see the tear film has three different layers. It has a mucus layer on the bottom, watery layer in the middle, and an oil layer on top. The oil layer, as I was just talking about, they're from the meibomian glands. I'm drawing that again in that teal so it's a little bit more clear. The watery layer is secreted from the lacrimal glands, and the mucus layer is secreted from the goblet cells. The goblet cells reside on the surface of the eye itself. So taking another step back and looking at our original model eye one more time, the next thing I'm going to talk about are the muscles in the eyelids that actually help us open and close our eyes. I'm going to draw one more model here, this goofy little face. I'm going to label it right and left just so there's no confusion. On the right side of this guy's eye, I'm going to draw the orbicularis oculi muscle. On the left side, I drew the levator palpebrae muscle. The orbicularis oculi is responsible for closing the eye. The levator is responsible for opening the eye. Something important to remember about these two, the orbicularis is innervated by cranial nerve 7. The levator is innervated by cranial nerve 3. So if you kind of think about this in neurology, you know that Bell's palsy is like cranial nerve 7 palsies. Patients have trouble closing their eyes, and then on the other hand, cranial nerve 3 palsies, you get ptosis. You can't really open your eyes, which makes perfect sense because if you don't have cranial nerve 3 working, your levator doesn't work, you can't open your eye. And then on the other side, cranial nerve 7 is not working, orbicularis doesn't work, you can't close your eye. Okay, taking another step back, the next thing we're going to talk about is the lacrimal gland. If you guys remember from earlier, the lacrimal gland is the thing that provides the watery layer to the tear film we were talking about earlier. So I'm going to draw a little model here one more time. Drew a nose to help everybody understand where we are in the face. So the lacrimal gland is up here on the superior outer temporal side of the eye. It goes up there, produces some tears, flows throughout the eye, and then it drains through these two puncta on the medial side of your eye. You can actually see this puncta in the mirror if you look close enough. The puncta are then connected to some anatomic tubing that you can see that I'm drawing in pink here. And then those all drain into something called the inferior turbinate, which then drains all of that tear stuff into the nose. So this is important to remember, actually, that it drains into the nose because a lot of the medication that we use in the eye, like beta blockers and stuff for glaucoma, can cause systemic side effects by draining through this pathway. Okay, and back to our original model here. The next thing that I'm going to mention is the cornea. So the cornea is the very front clear surface of our eyeball. Drawing it in green here, highlighting it. Label it one more time, cornea. I'm going to draw one more model right here of the cornea in green. I'm going to go ahead and take a cross section of it just to show you guys what the layers are. There's 5 different layers, and so I'm going to draw it from outermost to innermost. The outermost layer is the epithelium, followed by Bowman's layer, and then we have the stroma, and then we have Descemet's membrane, and then on the most inside we have the endothelium. All of these have their own function, but today I'm going to focus just to basic focus on what the endothelium does. So it has the important role of making sure that the cornea doesn't get clouded by edema. Some fluid can build up there, and the endothelium makes sure that it doesn't cause problems. If you have too much fluid there, you start getting haziness, cloudiness in the cornea, which means obviously you can't see. So what the endothelium does is it pumps fluid in that direction that I've shown with the arrows. Okay, and taking a step out, the next things that we're going to cover here are the sclera and the conjunctiva. Drawing another model here, I'm going to label the white of the eye. The white of the eye is the sclera. If we take a cross section of it, you can see that there's a little bit of tissue overlying that. So I'm going to label this from inner eye to outer eye, labeling the sclera there, that's on the inner side, and then on top of it you can see the conjunctiva. The conjunctiva is transparent, the sclera is the actual thing that's white. And it's important to know that the point where the sclera and the conjunctiva meet the cornea is called the limbus. And it's also pretty important to know kind of the path that the conjunctiva actually takes in the eye and why it's such an important structure that we're talking about today. So I'm going to draw one more model here. I'm going to label the eyelids, label the limbus, the sclera, and then I'm going to take this little point on the conjunctiva just to kind of show the path that it takes. And I can only draw this in 2 dimensions, but you have to imagine this is going 360 degrees all around the limbus, all around the eye. The conjunctiva goes from that point, goes all the way around the eye, and then it actually settles down and attaches onto the inside of our eyelid. And so it's continuous with the eyelid. And the reason that's important is because if you wear contacts or if you get debris in your eye or something, the reason that doesn't go in the back of your brain, into the back of your head towards your brain, is because the conjunctiva is there to block it. So back to our original model of the eye, you can kind of see we've labeled the stuff we already know, including the limbus, the conj, and the sclera. The next thing I'm going to talk about are the chambers of the eye. There's 3 of them. There's the anterior chamber, the posterior chamber, and the vitreous chamber. Label these like so. The anterior chamber is the space from the cornea to the iris. Posterior chamber is iris to the lens, and the vitreous chamber is the lens all the way back to the retina. Zooming in here, I'm just going to label some more important structures here that's going to be important to our conversation about chambers. So we have the ciliary bodies here that I'm labeling in white. The ciliary bodies are important because they produce something called aqueous humor, which is the liquid that fills the anterior and posterior chamber. So I'm drawing it here in blue, labeling it aqueous humor. The aqueous humor is created by these ciliary bodies. It flows in anteriorly into the anterior chamber through the open pupil, and then it drains back into venous circulation at this corner between the lens and between the iris and the cornea through something called the trabecular meshwork, and then underlying the trabecular meshwork, the canal of Schlemm. It goes back into venous circulation that way. It's a pretty important piece of anatomy because if it goes wrong, you can develop glaucoma. And then moving backward into the vitreous chamber. So even though the anterior and posterior chamber are filled with the aqueous humor, it's more watery. The vitreous chamber is filled with something called vitreous gel. So as you can imagine, it's gel-like. It's important for it to stay that way. If it liquefies, you can actually get some pathology from that. And the next structure that we're going to talk about, just zooming in again, is the iris. There's not a whole lot to say about the iris. I'm just going to label it here for clarity. There's not a lot of pathology in it. We know already what it does. It contracts and relaxes. It's a muscle. And that contraction, that relaxation, is what makes our pupils change sizes. So the next thing I'm going to talk about is the lens and the zonules. So zooming in again, I'm going to label the lens here and then the zonules here. As you can see, the zonules come off the ciliary body and hold the lens in place. To get a better idea of how this works, I'm going to draw another model here. So these are the ciliary bodies. That's the lens in the middle. The ciliary bodies are important in this model because they can actually change shape. And I'm going to show you what happens when they do. So this right here is an example of the ciliary bodies when they're contracting. So as you can see, they contract. The zonules have less tension on them, and because they have less tension on them, the lens isn't pulled apart as much. And when that happens, the lens becomes more fat. So this is kind of what someone's eye would look like if they're looking at something near. So if they're reading a book or looking at their cell phone. And on the other hand, this is what happens when you're trying to look far. The ciliary bodies relax, which means the zonules tighten. And when the zonules tighten, they pull the lens apart and make it more skinny. So one more time, this is them contracted, and this is them relaxed. And just to put this into practice, I'm going to draw another model. The first one is going to be someone looking at text that's near. So as you can see in this model, the ciliary bodies are contracted, the zonules are loose, the lens is fat. If you're looking at far vision, if you're looking at that text from afar, you can see that I'm going to draw the ciliary bodies being relaxed, which means the zonules actually have more tension on them, and the lens is skinny. So this brings me to my next point about the lens, things that can go wrong. So obviously to see near, your lens has to be fat, but as we grow older, the lens kind of loses its ability to do that, and that's called presbyopia. And another thing that happens with a lens as we get older is cataracts. And cataracts are a pretty huge topic in ophthalmology. So I'm not going to be able to go over everything here, but I'm going to try my best to give a pretty brief overview. So I'm going to draw another model eye. And this is our lens. In the middle of our lens, I'm going to draw this in brown, is another part of the lens. Everything I've drawn here is called something. So the outermost part of the lens is called the capsule. The middle of the lens is called the cortex. And then the very middle of the lens is called the nucleus in brown. And it's important to focus on the nucleus here because that's where the most common type of cataract occurs. Nuclear cataracts are the ones you get from old age, and you can actually do surgery to take it out. So I'll kind of go over that here by making these two fake incisions in yellow that you see. That's where the surgeon would cut. I'm going to label it here incision. And once the surgeon makes the incision there, the next thing they're going to do is take out this part of the capsule that I'm erasing. And then they're going to go into the capsule itself and emulsify the diseased nucleus as well as take out the cortex. And after they've done that, they're going to go ahead and insert a new prosthetic lens in. The new prosthetic can't change shape. It can't become fatter or thinner to change the amount of light it's refracting. So patients are normally tested beforehand to see what power of prosthetic lens to put in so that they can see far vision perfectly. So saying that means that they won't need any glasses to see distance vision. But because the lens can't accommodate, it can't become any fatter, they can't read anything close up. So everyone after cataract surgery, if they're given this prosthetic lens to see far vision, they'll still need glasses to read near vision. And this is the most traditional type of cataract surgery with the most traditional type of intraocular lens put in afterward. Nowadays, patients actually have new options about what kind of lens they want in their eye exactly. But that's a long topic that I'll save for another video. So now just stepping back again, taking a look at everything we've learned about on our original model. The next thing I'm going to talk about is the back of the eye. And in the back of the eye, we have the retina and the optic nerve. So I'm going to draw the retina here in purple, and I'm going to label it retina, and we're also going to talk about the optic nerve. And before I talk about these two things, I just want to go over really quickly how the eye works. And by that I mean, how are we able to see an image from real life, from nature, in our eye? So to demonstrate this, I'm just going to draw another model eye here, drawing the ciliary body, the zonules, and the lens. All these things we've went over already. And staying consistent with our original model, I'm going to draw the retina back here in purple, and the optic nerve back here in white and yellow. And then I'm going to draw an image over here. I'm just going to write the word image on it. You can use your own imagination to think of whatever you want that to be. And then I'll draw the sun over here to represent the sun's rays, sending light down onto this image. And then whatever this image is, reflecting light back towards our eyes. And then once that light hits our cornea, the front part of our eye, the cornea refracts the light quite a bit. And then that light hits our lens, and our lens refracts it again. And all of that refraction eventually ends up with the light focusing perfectly on one point in our retina. And that gives our retina and our optic nerve the job of taking all that information from that one perfectly displayed image on our retina and sending it back to the brain. And so our question now is, how does that actually happen on a more nuanced, smaller level? So to describe this a little bit, I'm going to take a little cross-section of the retina right here. And I'm going to try my best to go over this in the most simple way possible. The thing is, the retina in reality has a bunch of different layers, as you can kind of see here. I'm not going to go over all of these right now. I'm just going to go over two of the most important ones that help us see. So those are the only two layers that are going to be in my cross section here. So the first thing I'm going to do is draw the back of the eye here in white. I'll label anterior, just so everybody has their bearings, anterior and posterior. And then at the bottom here, these little blobs I'm drawing are the photoreceptors, so rods and cones. These are the things that actually receive the light. And their job then becomes receiving the light information and then sending that information to the brain for interpretation. And the way they do that is they send this light information to the optic nerve through smaller individual nerves called ganglion nerves. And that's what I'm drawing here in yellow. And all these ganglion nerves come together, as you can imagine, and they form that giant bundle called the optic nerve that goes to the brain, and that is where the image is actually interpreted, is in the brain. So going back to our original model, we've covered a ton of stuff already. If you remember what our model looked like at the very beginning, it looked super bare compared to this. And we just have one more thing to cover before I finish this video. And it's the layer that supplies the nutrients to the retina. It's called the choroid. I'm going to draw it underneath the retina on our model here in blue. The choroid, as you can imagine, is filled with a bunch of blood vessels that are able to carry those nutrients to the retina. And the other significant thing about the choroid is that it's part of a bigger structure called the uvea. So the uvea, it turns out, includes two structures that we've already talked about. I'm just including all of these in blue: the ciliary body and the iris. And it turns out that the choroid is continuous with the ciliary body and the iris, and all of them together are called the uvea. Our label here, the choroid. And then again, everything in blue is the uvea. And the reason I'm talking about the uvea so much, the reason I'm bringing it up, is because there's a lot of pathology that can happen in it. So uveitis, for example, which I'm sure you guys have all heard about, it's a pretty common painful inflammatory condition where these structures become inflamed. It's pretty common in rheumatologic disorders, and it can also happen outside of that as well. And just to hammer in this point that these three structures, the iris, the ciliary body, and the choroid, are all continuous, I'm going to circle them all in orange. And I'll even write over here, iris plus ciliary body plus choroid equals uvea. And one more time, all of these are continuous. So that's everything. That's all I had looking back at our model. As you can see, we've covered a lot, so look at this versus our base model. Hopefully this video is helpful for you guys. Let me know any questions you have in the comments. Thank you guys so much for watching, and have a great day.